Welcome to the overview of Acute Oncology, Module 1 of the Acute Oncology Trainer Series. This CPD UK accredited module will introduce you to acute oncology, the complex acute medicine oncology interface. Did you know that up to 5% of emergency admissions are cancer-related? Cancer patients are still dying of neutropenic sepsis, and spinal cord compressions are still being missed in spite of huge advances in chemotherapy. Are you confident of recognizing them early and managing them effectively? The Royal College of Physicians in London and the Royal College of Oncology identified the acute cancer care crisis way back in 2012 and recommended the training of frontline clinicians to make them aware of the unique complexities of the unwell cancer patient. The Acute Oncology Trainer webinar series will train you to identify the important cancer-related emergencies early and manage them effectively. As a London-based hemato-oncologist with over 20 years of clinical experience and 15 years of teaching experience, I believe that acute oncology training needs to be more robust among medical students and doctors, especially frontline clinicians. Acute Oncology Trainer is a high-impact global digital initiative to address the weakest link in the cancer patient's journey. Our mission is to train 100,000 medical students and frontline clinicians to recognize oncological emergencies early and manage them effectively. Acute oncology is a delicate interface between two important specialities, and errors can lead to delayed or missed diagnoses and unnecessary medico-legal problems. Acute oncology is a very frequently tested subject area for postgraduate or Royal College or fellowship exams. We can help you develop a cancer patient journey for your hospital. Use your creativity to solve unmet needs of cancer patients, or use one of our audit themes to gather baseline data. What is acute oncology? In simple terms, acute oncology is the management of the acutely unwell cancer patient. In other words, the complex and unique issues at the acute medicine oncology interface. With the increase in cancer cases worldwide, the number of cancer patients who present unwell to hospitals is increasing. Also, with the improvement in diagnostics and screening, more and more cases are being detected. Better treatment options, especially immunotherapy, means that cancer patients are living longer. Unfortunately, acute oncology continues to remain a weak link in the cancer patient's journey. You're all familiar with the typical acute medicine cases in medicine surgery and orthopedics. Well-defined pathways or management plans are in place in hospitals for these commonly seen cases. In contrast, acute oncology poses unique challenges to frontline clinicians who are not familiar with the complexities of cancer treatment. The care pathways are not well defined in many cases. Oncology is a complex speciality. There are at least 8 reasons why acute oncology cases can become complicated. Let's look at them in more detail. Oncology has multiple specialities within it. Medical oncologists administer chemotherapy, surgical oncologists perform surgeries, radiation oncologists organize radiotherapy, and hemato-oncologists treat blood cancers and perform bone marrow transplants. A patient can be under the care of one or more of these specialists at any given time. Oncology patients are frequently immunocompromised, therefore need combination antibiotics and for longer duration. Oncology patients may also have other conditions such as HIV, hepatitis, uncommon viral infections or fungal infections. Cancer treatments are expensive, and treatment may be delayed awaiting funding or insurer clearances. The cancer chemotherapy and immunotherapy landscape is evolving rapidly. Newer drugs are being licensed all the time. Some of them have unique side effect profiles that frontline clinicians may not be aware of. Cancer patients and their carers are well informed about their serious condition and have access to patient support groups and other information networks. They may have other age-related or comorbidities that can interfere with cancer treatment. The duration of cancer treatment can be prolonged. It can range from 6 months, 2 years, or even indefinitely. The Royal College of Physicians of London publication showed acute oncology admissions were due to a new cancer diagnosis in 20% of cases, treatment-related complications in 30% of cases, and cancer-related complications in 50% of cases. This explains why a good acute oncology service is so critical to avoid missing new cancer diagnoses and missing tremens-related complications. A rather simplistic view of an acute oncology admission is that an unwell cancer patient gets admitted to hospital, the trigger is readily identified, fixed, and the patient is discharged. But the ground reality is different. The unwell cancer patient can be at least 8 different points in their cancer journey. Undetected cancer, under investigations for a potential cancer diagnosis, recently diagnosed with cancer and awaiting chemotherapy, on chemo responding well, or they can be on chemo with an inadequate response, completed chemo on monitoring, relapsed and on 2nd, 3rd, 4th or 5th line of chemotherapy with a good response, or may not be responding, an alternate line of treatment required. It is important to find out where the patient is on this timeline, as the management varies. Let's explore the journey of a 55-year-old male who has been recently diagnosed with a type of blood cancer called multiple myeloma. It is a form of bone marrow cancer that secretes a cancerous protein called paraprotein. This paraprotein causes anemia, damages the bones and kidneys. He presents to his general practitioner feeling tired, was noted to be anemic. Tests were requested to ascertain the cause of the anemia. Unfortunately, over the weekend, he became very unwell and was admitted to accident and emergency. He had raised calcium, renal failure, and noted to have a fractured right humerus. His creatinine was significantly elevated, therefore commenced on hemofiltration. Blood tests revealed an abnormal paraprotein, and a working diagnosis of myeloma was made. The patient was noted to have vertebral fractures, and he was taken to the interventional radiologists for vertebroplasty. He had orthopedic and radiation oncology input for his lytic lesions. He needed an urgent review by hemato-oncology, chemotherapy nurses to administer urgent chemotherapy, palliative care input for pain relief, physiotherapy assistance for mobilization. The multidisciplinary input for myeloma. In this example, you saw a myeloma patient and his carer going through a maze of 12 different specialities in different clinical areas, and all this in an unwell patient who is financially stretched, worried about his prognosis, enduring chemo and its side effects. Are you seeing the bigger picture here? This is why acute oncology will be the weakest link in the cancer treatment landscape. As you can see, oncology has diagnostics, therapeutics, and support staff. And in this slide, you can see the various divisions offering treatment, diagnostics, and support services in oncology, and the various divisions of casualty or emergency medicine. The boxes highlighted in green are the various departments that were involved in the care of the myeloma patient. The myeloma patient and his carer went through a maze of 12 different specialities in different clinical areas. Already unwell, financially stretched, worried about prognosis, while enduring chemo and its side effects. Are you seeing the bigger picture here? A multidisciplinary team for the clinician and support staff, or a meandering maze for the patient and his carer? This is why acute oncology will remain a weak, if not the weakest link, in the cancer treatment landscape. Acute cancer patient pathways need to be smooth to avoid diagnostic and therapeutic delays, breakdown of trust between the patient and clinician, or between clinicians, or between the clinician and the hospital. The Acute Oncology Trainer is a high-impact digital training initiative. If we assume you will see 12 acute oncology cases per year, and by training 100,000 doctors, up to 1.2 million cancer patients' cases will be potentially managed more effectively. That is a huge number. Assuming 5 days per patient and 5 days of care are saved because of early recognition and effective management, this could amount to 12 million working days. And mind you, this does not even include the resources that you spend on delayed or missed diagnosis. Now, let's see how we can develop an acute oncology strategy for action. Check if your colleagues, junior doctors and nurses, are aware of the emergency management of neutropenic sepsis and spinal cord compression and protocols in your hospital. Review the acute cancer pathways at your clinical settings. When was the last time an audit was conducted on waiting times for arriving at a diagnosis? When were the local guidelines last updated? These are excellent opportunities to develop your leadership and stewardship skills. Practical ideas for audit and to improve your CV. The Acute Oncology Trainer Audit Challenge. There is a lot of focus on improving cancer care worldwide. Oncology audits will give you an excellent opportunity to present at national-level audit meetings and conferences. What is a clinical audit? Essentially, it is a form of quality check if clinical standards are being met, and if they are not being met, to find out why. So you plan an audit, do it, analyze it, and most importantly, act on it. Don't forget to re-audit later to see if your suggestions or recommendations are working. Improve your CV by using one of the following acute oncology audit themes as a starting point. Follow the PDSA framework to conduct your audit. Some examples are included here. Feel free to download the PDF of the audit themes. Don't forget to submit your audit report and suggestions for improvement, and you will be awarded a certificate for conducting an audit. The Project ACT Innovation Challenge. Suggest an innovative idea or concept that can improve the journey of the unwell cancer patient, and you could win an iPad. Spread our message among your clinical colleagues, and you will be awarded a certificate for demonstrating leadership in acute oncology. Send us an innovative practice in your hospital or clinic, a useful cancer app that you are using, a digital resource or website for cancer patients. Don't forget to register for future webinars on neutropenic sepsis and spinal cord compression, and hypercalcemia, renal failure, SVC obstruction tumor lysis syndrome. Please feel free to contact us with your suggestions, feedback, and audit reports. Thank you for listening to this educational webinar on oncological emergencies.